We are going to be addressing few of the doubts that our inpatient and outpatient patients generally have. So sir, the first question that I would like to ask, how does facial aesthetics relate to function, chewing, breathing and speech?
So the question is, how does facial aesthetics related to function, right?
Yes, chewing, breathing, speech,
Yeah,
everything.
so face is between the forehead and the Adam's apple around the ear. So you have the eyes. So there are multiple functions on the face. That's number one priority you have to understand. And so I have this philosophy: when you treat patients with facial issues or facial concerns or facial desires or anything the patient has, the first thing that I would like to consider is that the philosophy, which means that function is the most important. Following a good function, you draw a line in the midline and you make sure the face is symmetrical. And then the more important thing in terms of aesthetics, also proportion. So how proportional is your face per se? Do you have the nose matching well to the jaws? What does the lip do? How is the eyebrow? What happens to the various subunits of the face? So that is what we call as a proportion. So to answer this question about the intermingling of the aesthetics with function, function is most important. And very often you see that in nature. So I tend to look at my patients with the functional aspect first and foremost, then looking at the asymmetry, because you need to have some amount of symmetry, and then the proportion. So we try and tailor each one of these things subtly in order to get that face that the patient is desirous of, or the improvement that we can give these patients.